Hello everyone and welcome back to another lecture video. Today we are going to talk about neurophysiology and our topic for today is very interesting. We are going to talk about the autonomic nervous system and this is a very nice lecture. This is one of my favorite lectures and I hope that you will learn a lot of things in this lecture. So when we talk about the autonomic nervous system, this is a part of the nervous system that controls and regulates internal organs without any conscious recognition or effort. Like, for example, we do not really think about how we want our heart to, how fast our heart will beat. We don't really think about that, or how our gastrointestinal system or our gut will process the food. So we are not consciously thinking about it, diba? Like when you're walking or when you're talking with your friends, you won't say na, wait lang ha, gusto ko lang magpalpitate for a while, I'll just increase my heart rate. That's not correct because when we talk about the autonomic nervous system, this controls our internal organs without any conscious effort. Like you don't think about it. You're not going to really be able to control how fast or how slow you're going to breathe. So that is a function of the autonomic nervous system. So it comprises two antagonistic set of nerves. So we'll learn about the sympathetic nervous system and the parasympathetic nervous system. And it connects the internal organs to the brain by spinal nerves. And when this is stimulated, it can prepare us for stress, fight or flight response, and also for the parasympathetic nervous system that is for rest and digest. So first, let's talk about the different things that we need to learn about the autonomic nervous system. So here we can see that we're trying to differentiate the somatic nervous system from that of the autonomic nervous system. So in the somatic nervous system, we can see that it's voluntary. So when you see the word somatic, think about voluntary movement. That's why we are trying to differentiate this because as I've mentioned earlier, autonomic will control involuntary movement or it's an unconscious effort, while that of the somatic nervous system, it will control voluntary movement. So we can see here, it has one motor neuron system. So say for example, from the somatic efferent innervation from the spinal cord, it will only have one motor neuron system. So we can see here the motor neuron, its axon, and then innervating our skeletal muscle, which are voluntary muscles, right? It causes voluntary movement. So we can see here it uses acetylcholine and it innervates a skeletal muscle for voluntary movement. So this is excitatory for skeletal muscles. Comparing to that of the autonomic nervous system, as we can see here, it causes involuntary movement and it has two motor neuron systems. So if we take a look at this picture, you can see here from the spinal cord, we have here one motor neuron. So it shows here a myelinated preganglionic fiber. So we'll talk about this fiber. So when you say pre, it means before. Before the ganglion. That's why it's called preganglionic fiber. And this is the ganglion. We call this the autonomic ganglion, wherein it's synapses with another motor neuron. So here it uses acetylcholine and synapses with another motor neuron. And this motor neuron, this is the second motor neuron, which then activates or innervates the visceral effectors such as your cardiac muscle, smooth muscle, and glands. So, yeah, I just remembered because I was talking to my cousin in the US earlier. She corrected me. Sabi niya, ate, why do you keep on saying synapse? Di ko tuloy naintindihan, sabi niya. Ito kasi nag-aral na siya in the US. She took pharmacy doctor. She's a pharmacy doctor. Sabi niya, you should teach your students to pronounce it as synapse.
Synapse. Synapse. Synapses. Synapses.
Pronounce it as synapse. Para if they go to the United States, they will not be they will be understood when they say the word synapse, not synapse. Okay, so in class, so pag nandito tayo sa Pinas, okay lang yung gamitin natin yung synapse. Pero pag, when we go abroad or elsewhere, we pronounce it as synapse. So, pasensya na kayo. Sometimes, of course, I got used to saying it as synapse. So, pwede rin natin i-try yung synapse. So, here, one motor neuron will synapse with another motor neuron. So, it has two motor neuron system. So, we have here excitatory or inhibitory for cardiac muscle, smooth muscles, and glands. So we see here the difference between a somatic nervous system, which controls voluntary muscle, and an autonomic nervous system. Because for somatic nervous system, it is basically excitatory. But for autonomic nervous system, it could be both excitatory and inhibitory. So we can also appreciate the different muscles they innervate. For somatic nervous system, these are muscles which controls voluntary movement, while that for the autonomic nervous system, these are muscles that control involuntary movement, such as that of the control of the heart rate. So here we can see the organization of an autonomic nervous system. So I want you to remember it has two motor neurons, and it will originate, the cell body of the first motor neuron will originate in the central nervous system, while that of its axon will travel along the peripheral nervous system and synapsing in the autonomic ganglion. Now, we call this a preganglionic neuron. Again, so to better understand the term, pre means before the ganglion. So this is the first neuron, and it is located before the autonomic ganglion. So we have here your autonomic ganglion. So when we talk about the word ganglion, what does it mean? So ganglion means the collection of nerve cell bodies, meaning in this autonomic ganglion, there are different cell bodies grouped together. So we call that autonomic ganglion. And because these cell bodies are located outside the central nervous system, then we call them ganglion. Okay? Ganglion. So why do we call the basal ganglia as ganglion when it is located in the central nervous system? So that's a very good question. Actually, it's not named correctly, because when we talk about ganglion, these are group of nerve cell bodies that are located outside the central nervous system. So when we talk about a group of nerve cell bodies that are located in the central nervous system, we call that nuclei. But if it's outside the central nervous system, we call them ganglia or ganglion. Now here, going back, we can see in this picture, in the autonomic ganglion, the first motor neuron, which is called the preganglionic neuron, synapses with the second motor neuron, which we are now going to call postganglionic neuron, because it's located after the autonomic ganglion. So here is the nerve cell body, its axon, and its axon will synapse with that of the effector organs, which, as we have mentioned, includes those that control involuntary movement, such as the cardiac muscle, smooth muscles, glands, and adipose tissue. Here, what I would like to emphasize, we already have mentioned these three statements earlier. So what I want to emphasize here is about the adrenal medulla. It is a specialized ganglion of the sympathetic nervous system. So specialized ganglion of the sympathetic nervous system, meaning that it is a group of nerve cell bodies that is located outside the central nervous system. That's why it's called specialized ganglion. And why is it specialized? Because it is only specific for the sympathetic nervous system and not for the parasympathetic nervous system. Now, going back to the preganglionic neuron, so to give emphasis, so it is the first of the two autonomic motor neuron. Again, class, the cell body is located in the central nervous system or in the gray matter of the spinal cord or brain. And the preganglionic axon passes from the central nervous system in a spinal or through a cranial nerve. And the axon will terminate in the ganglion. For the ganglion, this is what we have mentioned. It is a collection of nerve cell bodies that is located outside the CNS. And these cell bodies give rise to postganglionic neurons. So we can see in this picture the postganglionic neuron, which is the second of the two autonomic motor neurons. So this is a review. And the postganglionic axon will pass from the ganglion to the effector. And the peripheral effector is either stimulated or inhibited because it could either be excitatory or inhibitory. Now, on this slide, we can see and appreciate here a table that is a summary of the topic. And here we can see the characteristic of sympathetic versus the parasympathetic nervous system, and we are going to compare them. So we have the mnemonic here, plasma. So plasma is our mnemonic specifically for parasympathetic nervous system, kaya siya nakatapat dito. What does plasma stand for? Letter P. So the origin P stands for parasympathetic, and we can see here its origin in the preganglionic nerve. When we talk about parasympathetic nervous system, we have cranial nerves, the nuclei of cranial nerves 3, 7, 9, and 10. So ang mnemonic natin dito is 1973. 19, diba? 10. Okay, and then we put the number 9, 7, 3. So 1973. So parang hindi kayo malito. But there was an exam before that I got confused because I thought, since it's 1973, I thought it's cranial nerve 1, 9, 7, 3. That's wrong. It should be cranial nerve 10, 9, 7, 3. So you can remember it by saying probably cranial nerves 10, 9, 7, 3. 10, 9, 7, 3. So that's better. Instead of saying 1973, or you can write 1973, but after the number 1, you put a small 0. So it will remind you. And aside from that, spinal cord segments S2 to S4. That's why we call it craniosacral, because we have your cranial nerves and sacral nerves S2 to S4. Now, letter L stands for long. What does that mean? We are talking about the length of the preganglionic nerve axon. So I'm going to show you a picture in the next slides, which shows us that for the preganglionic neuron, the axon is long. So plasma. Letter A stands for acetylcholine because this is the neurotransmitter that is released once the preganglionic neuron of the parasympathetic system synapses with that of the autonomic ganglion. And what is the receptor type in the ganglion? We have your nicotinic receptors. Now, letter S stands for short axon of the postganglionic neuron of the parasympathetic nervous system. And we have here, it reaches the effector organs, which are your smooth and cardiac muscle and other glands. And the neurotransmitter, so plasma, right? We'll start here, letter M first. The receptor type in the effector organs would be muscarinic. Remember, in the autonomic ganglion, the receptor is nicotinic, but right now, in the effector organs, the receptor would be muscarinic. And the neurotransmitter is still the same, which is acetylcholine. So we have what we call your plasma. So P stands for parasympathetic, L stands for long axon of the preganglionic motor neuron, A stands for acetylcholine, which is the neurotransmitter that is released when the preganglionic neuron synapses with that of the second motor neuron located at the autonomic ganglia. Letter S stands for short axon of the postganglionic neuron, and in the effector organ, the type of receptor is not nicotinic, but it's letter M, muscarinic, and the neurotransmitter is acetylcholine. Now, if we compare that to the sympathetic nervous system, the origin of the sympathetic nervous system, on the other hand, is from the spinal cord segments T1 to T12 and lumbar 1 to lumbar 3. That's why we call it thoracolumbar, from the thoracolumbar spinal cord segments. So T1 to T12 and L1 to L3. Well, this is craniosacral. On the other hand, magkabaliktad sila. Your sympathetic nervous system. So, as long as you know plasma, you can already try to just think what is the opposite, and that is that is what are the characteristics of your sympathetic nervous system. So, short, preganglionic nerve axon, and the neurotransmitter in the ganglion is acetylcholine. Remember, class, in the autonomic ganglion, the neurotransmitter is always acetylcholine, whether that's sympathetic or parasympathetic nervous system. So both its preganglionic neurons will release neurotransmitter, which is acetylcholine, and both of them has nicotinic receptors as well. So same lang, so don't forget about that. Well, in the postganglionic nerve axon, the length of the postganglionic in sympathetic is long compared to that of the parasympathetic, which is short. And the effector organs also include your smooth cardiac muscles and glands. And now, we have a difference in the neurotransmitter. So take note, in the preganglionic, same neurotransmitter, same receptor, but in the postganglionic, we have different neurotransmitter, different receptors. So as we can see here, the receptors are alpha-1 and alpha-2 receptors, beta-1 and beta-2 receptors for sympathetic, and the neurotransmitter is norepinephrine, except for some things that you have to remember, such as that of the sweat glands, which uses acetylcholine. So these are exceptions. Now going back, remember class, when we say somatic nervous system, it controls voluntary muscles. So the effector organs are skeletal muscles, and sabi natin, it does not have two motor neurons but only one motor neuron. And what is the neurotransmitter used? It's acetylcholine, and the receptor would be nicotinic. So don't forget plasma. Okay. Now this is a picture just to show us what we have been trying to discuss. So parasympathetic P plasma, all of their preganglionic neurons, both sympathetic and parasympathetic, originates in the central nervous system. But as you can see here, the preganglionic neurons axon is long. And what is the neurotransmitter release? It's acetylcholine. What is the receptor? It's a nicotinic receptor. While in the postganglionic neuron, the axon is shorter. That's why S, diba? And then the receptor is muscarinic, M, and the neurotransmitter is acetylcholine. So that's plasma. Now, on the other hand, as you can see here, this is the preganglionic neuron of the parasympathetic nervous system, and this is the preganglionic neuron of the sympathetic nervous system. It is much shorter, but they have the same neurotransmitter, which is acetylcholine in the preganglionic motor neuron, and its receptor is nicotinic receptor as well. And if we try to look at the postganglionic neuron, its axon is longer than that of the preganglionic neuron. But we can see here it has a different neurotransmitter, which is norepinephrine, and also different receptors, the alpha and beta receptors. Now, what we would like to show you here as well is the adrenal gland, which we said is a specialized ganglion for the sympathetic nervous system. Why? Because these are a group of cell bodies that are located outside the central nervous system. And they have here, it only has one motor neuron also, and it releases what neurotransmitter? It's acetylcholine. And what would be the receptor? It will be a nicotinic receptor. And then the adrenal gland will then release what class? It will release epinephrine. Majority is epinephrine at 80% and norepinephrine at 20%. So this is specifically for the sympathetic nervous system. Now, we have here another picture showing us the somatic nervous system. So it's just a single motor neuron, and it synapses with your skeletal muscle using the neurotransmitter acetylcholine, and the receptor is nicotinic receptor. So here we have, we're just going to have, again, a quick recap. So sabi natin, for the peripheral nervous system, they are located in the lateral gray horns from S2 to S4, and cranial nerves 10, 9, 7, 3. That's why it's called craniosacral. So we can see here the cranial nerves 3, 7, 9, and 10, and the different areas they control. For example, for cranial nerve 3, we have here the ciliary ganglion. Cranial nerve 7, we have the sphenopalatine ganglion and the submandibular ganglion that controls the salivary gland. The cranial nerve 9, on the other hand, we have here the otic ganglion, and then which also innervates a salivary gland, diba? We cannot control our salivary glands. Hindi natin pwedeng isipin lang that we want to produce saliva. It's an part of the autonomic nervous system function. And then we have the vagus nerve, of course, class. It has the cardiac plexus, which innervates the heart. We also have the pulmonary plexus for the lungs, an esophageal plexus, celiac ganglion for the gastrointestinal tract, and then an abdominal aortic plexus also, which controls the gastrointestinal system. So that is for the cranial part. Now we also have the sacral portion, S2 to S4, wherein we have here what we call your pelvic splanchnic nerves, which also innervates the lower portion of the gastrointestinal tract, as well as that of the bladder. And we have the inferior hypogastric plexus, which innervates the ovary or the genitourinary tract of men and women. Okay, so that is the craniosacral outflow. So we have what we call your terminal ganglia or the autonomic ganglion, and we have a long preganglionic axon and short preganglionic or postganglionic axons rather. Now, here in the sympathetic nervous system, as you can see, it is the thoracolumbar outflow. So if we take a look at this from the T1 to T12 and L1 to L2. So it also innervates, just like that of the parasympathetic nervous system. They control involuntary movements of glands and that of the smooth and cardiac muscle. So we have here, it also innervates the salivary glands, the heart, lungs, and it's actually the same with that of the parasympathetic nervous system. But of course, this is for excitation. And what I want to emphasize here, class, is that the postganglionic fibers of the sympathetic nervous system also innervates skin, blood vessels, and adipose tissue. So in the ganglia, it is located in, the autonomic ganglion is located in the sympathetic trunk, which we call your paravertebral, or it means located lateral to the vertebra. And we also have collateral ganglia, which are located in the prevertebral area. So again, the preganglionic, as you can see here, the preganglionic axons are short, while the postganglionic axons, represented by the red colored line, are longer as compared to that of the parasympathetic nervous system. Now we have here the adrenal medulla, and we have mentioned this earlier. It is a specialized ganglion, and take note, class, these preganglionic fibers will synapse directly in the adrenal gland on its chromaffin cells, or in the adrenal medulla. So meron kasi tayong adrenal cortex and medulla. So a specific portion of the adrenal gland that is synapsing with that of the preganglionic fibers is that of the adrenal medulla, which is composed of what we call chromaffin cells. And these chromaffin cells secrete majority of its secretion is epinephrine, while only 20% is norepinephrine. Now, we have a condition which we call pheochromocytoma. This is a tumor of the adrenal medulla that secretes excessive amounts of catecholamines and is associated with increased excretion of VMA. So this is the 3-methoxy-4-hydroxymandelic acid. So this pheochromocytoma, if you can just imagine, if the adrenal medulla will form a tumor, and these are made of chromaffin cells that secretes excessive amounts of catecholamines, which are your epinephrine or norepinephrine, the side effects will be very, very difficult to manage. So, difficult to control symptoms. Because if you have very high epinephrine, what will be the symptoms? Number one, you will have a very high blood pressure, severe headache, tachycardia or fast heartbeat, heavy sweating, which is also part of the sympathetic nervous system, tremors, paleness, shortness of breath as well is seen. So the patient will be very, very anxious, and we have to control the blood pressure of the patient. So what are the physiological effects of our autonomic nervous system? So as we have mentioned, this is dual innervation. We have excitatory for sympathetic nervous system and inhibitory for the parasympathetic nervous system. So as we can see here, from the brain, we have parasympathetic nerve fibers of the oculomotor nerve 3, which synapses in the ciliary ganglion, which then causes cholinergic stimulation of the pupillary constrictor. So what happens for parasympathetic, we will have a constricted pupil. Like for example, if you want to rest, you want to just watch a movie, you're not stressed at all. So you don't have to accommodate a lot of things. So the eyes will constrict. As compared to that of the sympathetic nervous system, it will then synapse with the superior cervical ganglion, and then its sympathetic fibers will innervate or will cause adrenergic stimulation of the pupillary dilator, then it will cause dilation. So for example, if you are being, if there's someone behind you and you're afraid that he might grab you or he might snatch your phone or your bag, and you want to see where you are going because you're starting to run and you're very nervous about it. So you want your pupils to dilate in order for you to see the environment where you can go to, kung saan ka pwedeng magtago, saan ka pwedeng humingi ng saklolo. So that is what we call dual innervation. So it uses different neurotransmitters as well. So we have the neurotransmitters in the postganglionic motor neuron, which differs. So we have norepinephrine and acetylcholine. So this is another picture which shows us vasoconstriction of an artery and vasodilation of an artery, which are two different effects, but because of the autonomic nervous system, we can either inhibit or excite it. So for the next part of our lecture, we'll talk about the neurotransmitters and receptors of the autonomic nervous system. And I think we have emphasized very well in the first slides that for the preganglionic neuron, whether that's sympathetic or parasympathetic, they both release acetylcholine and both of their receptors are nicotinic receptors. But on the postganglionic neuron, this is where they differ, such that for the sympathetic nervous system, we have the alpha or beta adrenergic receptor here, and the neurotransmitter is norepinephrine. Of course, usually, or almost all of the time, it's norepinephrine. But there are exceptions. So, nakalagay dito, occasionally, it also uses acetylcholine and a muscarinic receptor. So, we're going to talk about the exceptions later. Well, here in the parasympathetic nervous system, class pa ulit-ulit, no? But it's a good thing because you can review. So, the neurotransmitter release is acetylcholine and the receptor is muscarinic. So on this table, we differentiate the neurotransmitters, which are adrenergic, cholinergic. Another is the category non-adrenergic and non-cholinergic. We'll start with that of the adrenergic. The neurotransmitter is norepinephrine, and it is most commonly seen in the postganglionic sympathetic nervous system. And we have here the catechol O methyltransferase and monoamine oxidase, which we will learn later on, will cause the degradation of norepinephrine in the synaptic cleft. While that of the cholinergic neurotransmitter, we have acetylcholine, and where do we see it? In all the preganglionic motor neuron, whether that's sympathetic or parasympathetic nervous system, and of course, in the postganglionic neuron of the parasympathetic nervous system, and a few of the postganglionic sympathetic nervous system. Now, we have acetylcholinesterase, which causes the degradation of acetylcholine at the synaptic cleft. Now, what are our non-adrenergic and non-cholinergic neurotransmitters? We have here your substance P, vasoactive intestinal peptide or VIP, and your nitric oxide. And they are seen in some postganglionic parasympathetic nerve fibers of the gastrointestinal tract. So you have to remember that when you are going to be asked in the exam, do we have neurotransmitters that are non-adrenergic and non-cholinergic? Yes. Where can we find them? In the gastrointestinal tract. Is it only autonomic nervous system or only in the parasympathetic nervous system, or rather in the sympathetic nervous system? Our answer would be in the PNS. So I hope you understood that, class. Moving on, we have here the different signaling pathways and mechanisms for autonomic receptors. So this is a very good table because it shows us the type of receptor and its location and the G protein that is used and its mechanism. So this is a very, very nice table. This is my favorite. So my mnemonic here is kiss and kick. So una, diba, gusto mo munang mag-kiss and then kick. Sometimes we do that, diba? Very sweet. Tapos after nun, medyo mataray ka na. So parang mood swings. Kiss and kick. So for adrenergic, it's kiss. For cholinergic, it's kick. So ito, makikita natin the different receptors. So for adrenergic alpha-1 receptor, they are located in smooth muscles, and the G protein is GQ. This is the G protein. So kaya siya kiss because it sounds like a kiss. Yung pagsunod-sunod nila is QISS for us to remember what type of G protein is used. And the mechanism uses your IP3 calcium. So remember, class, if the G protein is GQ, it is always paired with IP3 calcium. So inositol 1,4,5 triphosphate. Okay, so if it's GQ protein, then it is always paired with the mechanism which increases your inositol 1,4,5 triphosphate. Pag titingnan natin dito ulit, GQ, okay, IP3, GQ, IP3. So you have to remember that. Now, for alpha-2, it is located in the gastrointestinal tract and the protein is GI. So always remember, class, the second protein always is I. Even here, it's I. And this causes decreased cyclic adenosine monophosphate or decrease in the CAMP. That is the mechanism. For beta-1 adrenergic, okay, the location is the heart, while beta-2 is for smooth muscle. So the mnemonic here is we have one heart and two lungs. So beta-1 is located in the heart, while beta-2 will be in the smooth muscle of the lungs. And both of them, class, uses the mechanism GS or the G protein S, which causes increase in CAMP. So it's very easy to remember. KISS, lahat ng Q, GQ is IP3, while S will cause increase in CAMP, while I causes decrease in cyclic adenosine monophosphate. Now, next is we have your cholinergic receptor. So we have two receptors. In the nicotinic, we have NM, so nicotinic, and then you have your nicotinic N2. So nicotinic skeletal muscle, this is NM also because it's found in the skeletal muscle, M. NN or N2 is in the autonomic ganglia. So they do not use a G protein, and the mechanism is that they cause opening of sodium-potassium channels. So it's very different if you're going to use a G protein. So meron kang second messenger. So in the next type of cholinergic receptors, we have muscarinic 1, 2, and 3. So dito, class, ang mnemonic natin dito, para siyang pagmamahal. Letter M, di ba? M. Mahal. Kapag nagmahal ka, anong una mong gagamitin? M1. So for M1, what are you going to use first when For my Indian students, mahal means love. Okay, letter M in the Filipino language, M, which stands for mahal in my mnemonic, is love, or right, love. So when you love, what are you going to use first? So M1, you're going to use your brain. Follow your brain, okay? Kailangan natin maging smart. In loving someone, you have to be smart, diba? Number 2, M2, what are you going to follow next? After following your brain, follow your heart, diba? Follow your heart. And M3, what are you going to follow next, class? It's gonna be your other organs. O kung ano man yun, bahala na kayo mag-isip. Okay, so, muscarinic receptor 1 is found in the brain or in the central nervous system. The second muscarinic receptor, or M2, is found in the heart, and muscarinic 3 is found in the glands and smooth muscle. And the mnemonic here is kick. So remember, if you use the G protein Q, it will always cause increase in inositol 1,4,5 triphosphate. Well, when you say the second G, diba, is always I, and it will cause decrease in CAMP, or your cyclic adenosine monophosphate. So I hope this slide you will remember it until you take the board exam and even after that. Okay. So once again, let's review our receptors. So we have our adrenoreceptors, and we have your alpha-1, alpha-2 receptors. And for alpha-1 receptors, they cause a smooth muscle contraction of the arterioles. So one way for me to remember this, which I've learned in med school, is that this is the symbol for alpha. And when you, for example, it looks like a string, and when you pull one of its side, it will cause the inner circle to be smaller. So imagine this is an arteriole, and this is the alpha receptor. If you pull on one side, it will cause the arteriole's diameter to become smaller. So it will help me remember that it will cause constriction of the arteriole, or vasoconstriction. So that is for the alpha receptor. Now, your alpha-2 receptor, on the other hand, this is seen in sympathetic postganglionic presynaptic nerve terminals. So, postganglionic presynaptic nerve terminals, it is also seen in platelet, fat cells, and cell walls of the gastrointestinal tract. And take note, class, these alpha-2 receptors, what is unique about it is that it will cause the reuptake of norepinephrine. And if you are going to reuptake the norepinephrine, which is an adrenergic neurotransmitter, it will cause relaxation. So it's smooth muscle relaxation. Now, we have your beta-1 and 2 receptors. Remember, you have one heart and two lungs. So beta-1 is seen in the heart, specifically in your sinoatrial node, atrioventricular node, and the ventricles, as well as in the kidneys, and they cause excitation. So it will cause the heartbeat to increase, or your tachycardia, while your beta-2 receptor causes smooth muscle relaxation of that found in the lungs. So for example, for a patient with asthma, and you give them beta adrenergic, or if you give them a drug that increases your neurotransmitters that attaches to the beta-2 receptors, it will cause bronchodilation, which will make the patient have easier breathing. Now we have the cholinereceptors. We have your nicotinic 1 and 2. Nicotinic 1 is for the skeletal muscles, M muscle. It will bind with acetylcholine and will open sodium and potassium channels. Same thing with the mechanism of nicotinic 2, but the location differs such that it is located in the automatic ganglia, or dendrites of postganglionic neuron. So remember our mnemonic for this, mahal, letter M. When you love, first follow your brain, your heart, and then other organs. Okay, so again, they will bind with acetylcholine. And then we have your G protein Q, I, and Q. So we already know that. Now here, we have some prototype drugs that will affect autonomic activity. And we have an agonist and antagonist. When you say agonist, it is something that is pro to that effect. While when you say antagonist, it is against that effect. So beta at contra beta. So for alpha-1 adrenergic receptor, your agonist would be norepinephrine and phenylephrine. While that of your antagonist, we'll have your phenoxybenzamine. This is used for your pheochromocytoma. If you remember, this is a rare tumor that causes excessive increase or release of catecholamines because the chromaffin cells are also increased. So we give them phenoxybenzamine. Another drug would be your phentolamine and prazosin, which are all antagonists of alpha-1. For your alpha-2, we have an agonist, which is clonidine. If you remember, your alpha-2 receptors will cause the reuptake of norepinephrine. Therefore, this clonidine drug actually helps in the decrease of the blood pressure because the norepinephrine is being taken again, or reuptake of the norepinephrine is being done. While the antagonist is yohimbine. For beta-1, we have norepinephrine, isoproterenol, and the butamine as agonists, while antagonists would be your propranolol and metoprolol. Remember, for B1, that is for the heart. So that's why when someone is tachycardic, when a patient goes to you for checkup later and is tachycardic, meaning mabilis yung heart rate niya, what we give are antagonists of the beta-1 receptor such as your propranolol and metoprolol to control the tachycardia. For beta-2, we have your isoproterenol, and albuterol. So we give this for patients with asthma. Remember, beta-2 is for the lungs. So if you give them an agonist for that beta-2 receptor, it will cause the dilation of the bronchioles. So next, we also have your antagonist, your propranolol and butoxamine. For cholinergic class, for your nicotinic receptors, agonists would include acetylcholine, nicotine, like that of the cigarette, carbachol. The antagonist would be curare, hexamethonium. So this is in the ganglion but not in the neuromuscular junction. Well, for muscarinic, we have your acetylcholine, muscarine, and carbachol, and the antagonist would be atropine. So this is just an introduction of the drugs. So you will know later on when you're going to study pharmacology, the autonomic nervous system is very important for you to understand because there are a lot of drugs that has an agonist and an antagonistic effect to that. And in order for you to understand the mechanism of action of these drugs, you have to really master the autonomic nervous system. Now, we have some special notes here. These are things that you have to really learn and memorize by heart. Okay, so there are 3 sites with little or no parasympathetic nerve innervation, and the mnemonic for that is BCP. You have your blood vessels, C is cardiac ventricles, and letter P, pregnant uterus. Remember, I started it with letter P so that you would remember that it's not just the uterus, but it specifically says the pregnant uterus. So it has no parasympathetic nerve innervations. So here we have the effect of the autonomic nervous system on organ systems. And we can see here in summary, for sympathetic action in the heart, it will cause the increase in heart rate and contractility, and as well as atrioventricular node conduction with the receptors B1, while parasympathetic action would of course do the opposite. It will decrease the heart rate, the contractility, and the AV node conduction. And the parasympathetic receptor is M2. Remember, when you love someone, follow your heart. Heart though. Follow your brain, follow your heart, number 2, and other organs, number 3. Kaya M2. For your vascular smooth muscles, this is solely controlled by your sympathetic nervous system. So it causes constriction of the blood vessels in the skin, and it dilates blood vessels in skeletal muscle. So that receptor for the skin would be, blood vessels in the skin would be alpha-1, while that in the skeletal muscle would be your beta-2. Gastrointestinal tract, of course, for example, if a dog is chasing you, Are you going to stop in the store and buy some food and eat? Of course not, right? Ibig sabihin, or it means that if you're in the fight or flight response or sympathetic nervous system is activated, the gastrointestinal tract will not be working. So there will be decreased motility and the sphincters will be constricted. So the receptors will be alpha 2 and beta 2 and alpha 1 receptors. Well, that of the parasympathetic, we call this the rest and digest phase. When you say digest, meaning the gastrointestinal tract is active. Therefore, the motility is increased and the sphincters are relaxed. So that's the time that when you already know that no one is chasing you and you're already safe, that's the time that you relax and you can eat. So remember, for example, if something bad happens to you, parang di ka makakain, right? Because there's decreased motility. Well, when you are in the cinema, wala na palang cinema ngayon kasi pandemic. Well, you are watching a movie at home and relaxing. You tend to eat popcorn or eat a lot because your motility is increased. And the parasympathetic receptor is M3. For your bronchioles in our lungs, for sympathetic action, it will dilate our bronchicular smooth muscle. The receptor is B2, while that of the parasympathetic action, it will constrict your bronchus or your airway. And the parasympathetic receptor is M3. O, ito na class. For the male sex organ, for sympathetic action, it's ejaculation. The receptor is alpha, while parasympathetic is erection. The receptor is muscarinic. So my mnemonic for this is letter P, parasympathetic. P puts the penis up. Okay? Parasympathetic, so it causes an erection. While sympathetic is S, it shoots the semen out. So it's ejaculation. So it's very easy to remember. P puts the penis up. Parasympathetic is erection. S, sympathetic, shoots the semen out. That's ejaculation. Magkaiba pa pala, Doc, no? So dalawa pa lang nervous system, sympathetic and parasympathetic will be activated during coitus. The answer is yes, class. So, bladder. For the sympathetic action, it will relax the bladder wall but constrict the sphincter. So, therefore, pag hinahabol ka, hindi ka maiihi kasi constricted yung sphincter mo. The receptors will be beta 2 and alpha 1. While when you say parasympathetic action, it will contract the bladder wall and relax the sphincter. So, makakaihi ka. Di ba, class, kapag ihing-ihi ka na, and if you're very relaxed, maganda yung paglabas ng ihi mo, di ba? So, that is for the parasympathetic action and the receptor is M3. Okay, sweat glands. For sympathetic action, it will cause increase in sweating and it is solely controlled by sympathetic action. But remember, even if it's sympathetic, the receptor is muscarinic. This is one of the exemptions. All right. For the eyes, I think I've already shown you in the picture. So pag sympathetic, again, you want to see everything. So you're going to dilate the pupil. That's alpha 1 receptor. And that is for the radial muscle, iris. Well, for that of the parasympathetic, you have the circular sphincter muscle in the iris. And it will cause meiosis. These are the terms that you have to understand, class. Mydriasis, there's a letter D, dilate. So meiosis, constrict. Alright, so the receptor is muscarinic. And for the ciliary muscle, this is dilated. So it will give us far vision. While in the parasympathetic, it will be contracted. So it will give near vision. For the kidney, class, and fat cells, as you can see here, the kidney, the fat cells, and the sweat gland, and some vascular smooth muscles are only controlled by the sympathetic receptor. So for the kidney, it will increase renin secretion. That's beta 1 receptor. And for fat cells, it will cause increase in lipolysis or degradation of fats. So that's also beta 1 receptor. So I want you to remember that. Okay. So a special note that you have to remember For the adrenal medulla class, it's actually not essential for life, meaning we can live without our adrenal medulla. It just supplements sympathetic effects during exercise. And what are these cells shown here? These are your chromaffin cells in the adrenal medulla, and these are actually called migrated neural cells. In our neuroanatomy class later on, you will understand what it means and what are the different types of cells which are considered to be neural cells that has migrated. So one of them is your chromaffin cell, and it secretes epinephrine and norepinephrine. And if you remember, majority that is secreted is your epinephrine at 80%. We have here, this has been emphasized for a lot of times already. So it has sympathetic distribution, but the final neurotransmitter is not norepinephrine, rather it's acetylcholine, and the final receptor is muscarinic in the postganglionic motor neuron. So as you can see here, sweat glands, yeah. You have acetylcholine and muscarinic. So we have your sweat glands, some but not all, your piloerector muscles, your B3 receptors seen in brown adipose tissues which are present in babies. Okay, now just a very quick discussion on the areas that control the different centers or autonomic centers and the cerebral cortex. So when we talk about vasomotor center, so for the blood vessels, the respiratory system, the dorsal root ganglion and ventral root ganglion, DRG and BRG, swallowing, coughing, and vomiting center, the area that would control that would be the medulla class. So you have to remember that it's the medulla. So pag narinig nyo yung DRG, VRG, that would be the medulla. How about the micturition center, or for urination, the pneumotaxic and apneustic center for breathing? Where will we see it? It's in the pons. Very good. For temperature regulation, thirst, and food intake, how about this one, class? So you have to know these autonomic centers because it will be frequently asked in exams. So that would be your hypothalamus. How about the relay center for almost all sensations and memory recall? So that would be your thalamus. For motor, personality, calculation, and judgment. So what area in the cerebral cortex would be for the control of these autonomic centers? That would be your frontal lobe. How about the somatosensory cortex? That's easy. It's the parietal lobe. Yes. Vision. Easier pa to. It's your occipital lobe. Correct. How about for hearing? Balance or vestibular processing? Recognition of faces and the optic pathway or the Meyer's loop, that would be your temporal lobe. And lastly, for behavior, emotions, and motivation, that would be class your limbic system. So I hope that you try to learn about the autonomic nervous system by heart. So I would like to thank you all for your attention and see you in our next lectures. Bye-bye!